Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists veterinarians with employment contract and independent contractor agreement issues. Today I'm going to talk about production pay for veterinary associates. So, if you are paid on production, how does it work? And then some red flags or pitfalls that kind of are associated with that. So, first, obviously a veterinarian can be paid via a base salary. We are not going to talk about that today. It's very simple. If you're a relief vet, many times you'll just get, a certain amount per shift. What I'm talking about today is any kind of compensation based upon the veterinarian's productivity. Generally, that would mean collections, meaning not just what the vet produced, but what was actually collected. Now, in veterinary medicine, 99 times out of 100, it's private pay. And so the owner of the animal is just going to pay, either upfront or when it happens. Some places utilize veterinary insurance, and in that scenario, it's possible that you could do a service and then the insurance company denies the claim, reduces the fee, and so that would ultimately reduce whatever the veterinarian would receive. But it's not as big a deal in veterinary medicine when you're paid on a net collections model. The percentage difference is very small. In most collection-based industries, so like physicians, dentists, usually there's about a 5 to 6% decrease from what they bill out to what they collect. Where in veterinary medicine, you're probably going to lose 1% at most, maybe more. Another scenario would be if someone was put on a payment plan and then flaked on, completing that, although most offices do not do that. All right, so let's dig into the details of how you're paid and kind of what the different scenarios would be. So ProSal is pretty prevalent in the veterinary industry. And what that essentially means is you would have a base draw. So you come up with a certain amount of what you would receive for each paycheck, and then they would compare that to what your actual collections were. And I'm just going to say collections. I guess we could say production and collections are interchangeable. I'm just going to use the word collections here. So in ProSal, you'll come up with a base draw. So like, for instance, let's just say it's 100,000. You're going to get that every paycheck. And then at the end of the month, they're going to do a reconciliation. And so if what you brought in, and then there'll be a percentage attached to it, usually somewhere between 18 all the way up to 35%. Veterinary medicine, for whatever reason, it's on the lower scale versus some other professions. But if you're on like literal ProSal, normally it's somewhere between 18 to 22%. But if you're on kind of a hybrid model, it could be more than that. And so they will take whatever your collections are, and then if, let's just say you got 20% of that, they would compare the 20% to whatever they paid out via the draw. If there is excess, then they would pay that out, usually in the first pay period of the next month. Now, if there is a negative balance, meaning you collected less than you made in your base draw, normally that negative balance is carried forward, meaning it will move forward to the next month, and then you will be expected at some point to, cover whatever the debt that carried over. This can be a concern if someone is new to a practice. I would not suggest going into a pure compensation model immediately anywhere. There needs to be at least some kind of guaranteed minimum, usually for the first year. And that way, you can build up a patient base. You can understand the processes of the clinic that you're working at. Whereas if you come in immediately on collections and you're inefficient or you don't have a patient base to see, you could be carrying forward a pretty large negative balance. Beyond ProSal, it could be just a straight net collections model, meaning, like I said before, let's say you get 25% of everything that's collected. There's no kind of base draw. It's just at the end of the month, they'll do the reconciliation, and then you get that amount in the next pay period. So one of the most common problems is many of the employment contracts will state the veterinary associate will receive no compensation at all after the contract terminates. This is obviously a huge red flag if you're being paid on collections, because if you think of it this way, let's say you're working at a place, maybe it has a very large percentage of veterinary insurance claims. Those claims aren't going to come in for 30 to 60 days. And so if you're working your last month there, you get paid nothing after you're done, all these collections come in after the fact, you're giving up a bunch of money. Now, once again, in the veterinary industry, this is not that big of a deal, simply because so many people, pay privately and upfront. But it is something to think about. I don't think, being paid via collections is intrinsically unfair versus a straight base salary. For some vets who are very productive, it can be much more lucrative than if they were just given a straight base salary. But once again, it kind of depends upon the efficiency of the office. Do you have techs? Do you have assistants? Can you get through the patients in a reasonable amount of time? All those things contribute to how much money you're going to make. So if you're in an office that's very inefficient and they have a hard time staffing techs, and you're having to do everything yourself and you're only paid on collections, well, you're going to suffer because you're just not going to be able to see as many patients as you could in an efficient office. And in that scenario, it might make more sense to advocate for a straight base salary versus a collections model. So anyway, that's a little brief, discussion of collections and productivity pay for veterinary associates. If you have any questions, concerns, feel free to contact my office. Our contact info is listed below in the description, and I appreciate you watching the video. Thanks.